All right, welcome Fort Belvoir. We're going to stand by for a minute, but welcome to our Facebook Live virtual town hall. If I can get a sound check. Okay, good. We'll start in about 15 seconds. Hello, I'm Colonel Michael Greenberg, the Fort Belvoir Garrison Commander. Good evening, and thank you for joining us for our weekly Facebook Live virtual town hall. I'm joined to my left with Captain Cindy Judy, the Director for the Fort Belvoir Community Hospital. We're here today to give you an update and answer your questions on our continued measures that we are implementing to protect the force of the community and our service members. Again, thanks again for joining us. We've been trying to do this weekly to be able to continue to provide you clear answers and clear guidance that we're getting, and really to keep you updated on what we're doing here on Fort Belvoir. Thanks again to all those that are physically coming in to support this community each and every day. You know, we could not do it without, again, I'll leave some people out, but people like our hospital staff, our guards, our firefighters, our police, our child development center workers, all our contractors out there that are supporting this installation, and a whole host of others, including all the housing folks that are keeping our houses maintained. So thank you again for continuing to serve this community and continue to allow us to operate. I want to recap what we put out last week, talk about things that have changed from last week. I'll turn it over to Captain Judy, and she'll provide you some updates on the hospital, answer some questions, and then I'll answer some questions as well. So first, our health protection condition last week was announced at Charlie. As of this week today, we still remain at health protection condition Charlie, and we still remain at force protection condition Bravo Plus. The gates remain a no salute zone. I appreciate each person honoring that request for a no salute zone. That still remains in effect as we talk today. We implemented a curfew for those children below 18 years old. That curfew remains in effect. We are enforcing that. We do appreciate for the parents out there for your support in helping reinforce that guidance. We have not seen any issues across the installation. Last week we announced one of our CDCs was closed. We are planning to reopen that Child Development Center, location Joanne Blanks, on April 13th. More to follow as we get closer to that date. However, that is the plan at this point. You can find the recap of last week's town hall, along with the frequently asked questions from all the previous town halls on our homepage at Fort Belvoir website, home.army.mil/Belvoir. This week we've had several changes that we've been pushing out through our social media channels. I've seen your responses, I've read many of your comments and concerns, and I understand. In this environment, social distancing protocols have changed the way we operate as a command, a community, and as families. As your garrison commander, it's within my best interest to base my decisions on the social distancing protocols and to do everything we can to save lives, slow the spread of this virus, and to protect the health and safety of Fort Belvoir community. Again, like I said in our first town hall, I ask if you do not have accurate information, please do not post that in comments or post it on Facebook. Again, we at Fort Belvoir are doing our best to provide the community when we see an inaccurate statement, to provide accuracy. But again, instead of putting an inaccurate statement out there, please verify your information before you put it out. As many of you all know, on April 5th, the Secretary of Defense implemented a policy for people who live and work on federal property to wear face covering as a safety precaution if they are not able to maintain the social distancing of 6 feet. This includes places such as the hospital, commissary, exchanges, or anywhere else that you cannot maintain that 6-foot distance. I ask that you continue to follow these guidelines and where applicable, wear a face covering. I want to take an opportunity to dispel a couple myths and set the record straight and explain what the guidance means here on Fort Belvoir. First, face coverings are not required to enter the installation. I read a comment of someone who was denied access to the installation. Please, if that has happened, I apologize. I am not aware of that happening, nor has any of the guards been told to deny access to the installation. So again, that is not the guidance out there. It should not be happening. If it has happened, I apologize. Again, I have verified and believe that that is not happening. So again, if you are denied access, please see a supervisor at the gate. Reach out to Department of Emergency Services. That should not happen. Second, the commissary. So again, the Secretary of Defense has put out policy. At the commissary, there is very limited ways of staying 6 feet apart from an individual. The DECA leadership has issued guidance today. It's on the DECA website as well. It is requiring employees and customers to have face coverings to enter the commissary. So again, the expectation is that you have a face covering to go into the commissary. Again, it is okay if you do not have a face mask. That's not what the requirement is. In fact, those are actually for those medical professionals and that those who require that N95 or surgical mask, that's for those purposes. We're asking for a face covering. So service members have received guidance that they can wear a neck gaiter. Civilian personnel and all others can wear scarves as protective face coverings. We have also provided tutorials on Facebook on how you can make your own with a t-shirt, handkerchief, or other items that you can find around the house. AP's guidance is effective tomorrow. That will be expected, a face covering. I would like to just kind of relate it to what it would be for shoes and shirts. Okay, it's the same guidance. So you normally do not enter a commissary without shoes or shirts. Again, face coverings are being guided again by DECA leadership. The second major change that was announced this week was the closing of Lieber Gate. And so I want to be clear. So effective tomorrow, 0001, or a minute after midnight, Tully Gate will reopen as a 24-hour gate until further notice. Again, to be clear, we are not reducing the number of entry points into the installation. We still have 3 gates open. Tully Gate will be exactly what Lieber Gate was today. Tully Gate will be tomorrow. So Tully Gate, Pence Gate, and Farrar Gate will be the 3 gates opening. I've seen a plethora of comments on Facebook. Again, if you don't have accurate information, please, I ask you not to post that information. I've asked our public affairs to answer most of those comments out there, but with the current COVID conditions, and based off of my decision, that Tully Gate is the best suited gate for the situation that we have on hand. Again, everyone does not have all the facts and all the conditions that are presented to me when making that decision. And so I apologize for inconvenience that could cause of the extra drive of 5 to 10 minutes to the commissary. Again, that gate is the best suited gate for the needs of the community at large, Fort Belvoir Garrison employees, the staff, and the population. So again, that will stay open until we decide to change access control points. My top priority is to make the best decisions that will protect the Garrison and keep this community safe. Yet this is another measure to protect the health and safety of our community. As we move forward through this pandemic, please know change is the only constant that will remain the same. We are continually each day assessing all situations on the installation and making decisions based off the information that's given. With that, I'm going to now turn it over to Captain Judy, and she'll provide you updates and answer some questions.
Thanks, Colonel Greenberg. Hey, good evening, everyone. There's just a few changes that I want to talk about for the hospital today, and some of them are good news stories. But I'll start off with the one that's gotten a lot of attention recently, which is the entrances to the hospital. We did close the Rivers Garage and the access point at Rivers Garage. There's a lot out there in the National Capital Region about restricted access points. And we've been tracking the number of people who are entering the facility at each entrance. And the volume of patients and visitors has reduced dramatically as we continue to focus our efforts on acute, urgent, and emergent care during a public health emergency. We've determined that there's enough parking in the front lot to accommodate everyone. And then the flow through those main doors is quick, and the team monitors closely to ensure that there are not delays. We also have greeters there once you get into the main entrance to help direct people to make sure that there's nobody crowding as they come through those doors. So coming in the main entrance does not pose any additional risk at this time for people coming to the hospital. Closing the Rivers Garage has enabled us to prepare for some drive-up pharmacy capability that we hope to implement in the next week. I've brought somebody here with me this evening to talk about pharmacy. I've also brought somebody with me to talk about OB. We'll get to that in just a second. I want to talk about another change. So our COVID drive-up testing continues near the entrance of the emergency room, and folks are doing a really good job of staying safe and using that drive-up, and so thank you for that. As testing capability across our nation continues to increase, the National Capital Region is no different, and so one of the good news stories I'm here to report this evening is that our turnaround time for testing has decreased dramatically, and we're getting most test results within 2 days, sometimes 3, but most of them in 2 days or less. So that's a good news story. Sir, if I could for a second, I'd like to invite some of my guests to come up.
Absolutely.
So, would you like to talk about the pharmacy first?
Good evening, everyone. I'm Commander Sprague, the Director for Clinical Support at Fort Belvoir Community Hospital. Thank you, ma'am. As Captain Judy said, we will be introducing a drive-through pharmacy service in the Rivers Garage at Fort Belvoir Community Hospital in the very near future. So stay tuned to social media for full details on that operation. The intent in providing this service, the drive-through pharmacy, is to promote social distancing and to ultimately keep about 300 patients from having to enter the hospital every single day just to pick up their medications. To achieve the greatest benefit from this drive-through service, we ask that you activate your prescriptions, your new prescriptions, ahead of time. There are several ways, and again, the details of all of these ways will be provided on social media. One way that's already in place is to send a secure message to the pharmacy team. So some of you already have secure messaging in place with pediatrics, with your family medicine provider. You can see on our Fort Belvoir website how to add the pharmacy as another provider, and you can use this anytime to send a message to them, ask them questions about medications, but also if you have an appointment with your provider, say, hey, I had an appointment with my provider, please activate that prescription for me. They'll send a message back if there are questions, and they'll tell you when it's ready to pick up. So when that drive-through service is available, all you have to do is come in and pick up that activation step. That first trip up to the window is already done. Another way that will be available to activate your prescription is we're expanding our call tree in the pharmacy. Usually you don't call the pharmacy to activate, you come up to the window. You'll be able to call our pharmacy directly, talk to a staff member, and activate your prescription that way. That may be the least efficient way just because of call volume, but it is an option. Another way, you can still drop off a hard copy prescription or fill out our envelope at the PX lobby and drop it in that secure drop box. And then there is no change to the refill process. So you'll still call that number on your bottle or TRICARE online to renew your refill or request your refill for pickup at the PX pharmacy. One other note about social distancing. I know I do this where I say, I'm gonna go right when a particular service opens because it's gonna be the least busy. That's not necessarily the case at the PX pharmacy. That is the only time when you'll experience more than, say, a 4 or 5 minute wait at the PX pharmacy is if you go first thing. So I would just ask that you not all go right the first thing at the PX pharmacy. Otherwise, the wait time is about 5 minutes right now there, and you can easily social distance in that scenario. So again, stay tuned to social media for all the details. The Fort Belvoir team, the pharmacy team, has been working hard to make this a successful transition and make it seamless for you for the drive-through. Thank you, ma'am.
Thanks. Dr. Wood, would you like to talk?
Good evening, everyone. Commander Christy Wood. I'm the Department Chief of Obstetrics and Gynecology. Thank you, sir. Thank you, ma'am, for the opportunity to come and answer some questions that I know a lot of our patients have been having in regards to their OB care at Fort Belvoir. The first one that we have been getting from a lot of folks is, how many support people can I have while I'm in labor? That's a very good question, and we do want to allow our patients to have the family members with them. So at this current time, patients are able to have 2 support people with them. That can be a spouse, that can be a mother-in-law, that can be a doula, but for a total of 2. For any patients who are currently under investigation for COVID or have been tested positive for COVID, those people are limited to 1 support person, and that support person will remain in the room at all times with them and should not be wandering about the facility to minimize risk or exposure. In addition to that, looking at patients, family members coming in, so once you have your 2 support people, whether that's your spouse, your doula, your mother-in-law, those folks should be the ones who stay with you the entire time. We are not having folks swap out or have additional folks coming in. So you pick your 2, and they're the 2 with you for the entire time you're in the hospital. In that vein, doulas are considered a support person, so we absolutely want you to be supported and to have that opportunity in labor if you do have a doula with you. In addition, another question that was out was asking about whether or not you need to wear a mask in labor. So certainly in accordance with CDC guidelines, anytime we're in close contact, so less than 6 feet, we do recommend wearing a mask. So for our patients, when the care team is in the room, ideally the patient and their support folks will have the mask on. I understand and appreciate that that's challenging, especially when you're actively delivering. In that vein, our care team will be wearing a mask and they will have a face shield on. So even if your mask slips or comes off, we will still be protected, as will all the folks in the room. Other things that we're doing in clinic to help assist with minimizing your potential exposure, we are working on having telemedicine visits for certain key appointments so that you don't even have to come into the facility. In addition, when you do come to the facility, we are clustering your care. So if you present for your 28-week appointment, you're able to have your labs drawn in the clinic. We are doing that in the clinic, so you do not need to go to the lab or sit in the common waiting area. You're able to drink your glucola in the comfort of the exam room and then have your blood drawn 1 hour after that. So that's minimizing anybody's contact with other folks.
Thank you.
You're welcome.
Sir, I'll pass back over to you.
All right, thank you very much for the hospital updates. I'm going to move on to providing just some questions and answers and some updates on the commissary and post-exchange. And I'll start with the commissary. So we just already discussed the face coverings. Also, if you had not noticed, if you had not been to the commissary, we are starting to take temperature checks at the commissary. We started on Saturday. Again, and if you want to know more about it, if you go to our Eagle at the top portion, you can notice the article that talks about that. Again, this is just one way of looking at potential symptoms and identifying them. So when you get to the commissary, this is a passive thermal temperature apparatus. It basically will take your temperature from your eyes and be able to provide that within 2 to 3 seconds. The device is 6 to 8 feet away from you. And so when you get to the commissary, there'll be some service members that will ask you a group of questions. Please answer those questions. We'll ask you to remove your hat, face covers, and eyeglasses when you get to the line where that thermal temperature apparatus is. They'll take 2 seconds to register. If your temperature is over 100.4 degrees, there is a secondary temperature measurement. Okay, so we have an IR reader as well, an individual one that you place 6 inches from your forehead to confirm or deny whether your temperature is is accurately above the temperature. We'll ask you to go, we'll recommend that you seek medical advice. We'll ask you to continue to keep your face covering on, and we will ask you to wash your hands. For as far as hours of operation of the commissary, again, I ask you if you can spread out your shopping in the commissary throughout the day. So last week we continued to see very long lines at the beginning of the day, and it tapered out at the end of the day. So again, if you could start shifting your shopping habits, instead of waiting in the early morning, spread it throughout the day. I will tell you the misperception that if you don't get there first thing, you're not going to get the most high demanded items is an incorrect assumption, because if you haven't noticed, the commissary is stocking the shelves during the day as well. And so you may come in the morning and that high value item or high demanded item may be on the shelf in the afternoon, depending on the rotation cycle and when they are stocking the shelves. Generally speaking, the commissary is getting everything needed in the commissary. There are days such as when the toilet paper, the meats are doing very well, but pasta sauce and some spaghetti, there are days when some of those high demand items are off the shelf, but trucks are continuing to come in daily, and they are stocking the shelves as those come in. So again, I appreciate your understanding. As one waiting to get in the commissary, the commissary is restricting access as well in the numbers of people that are entering at one point. This helps optimize the social distancing that we're trying to enforce in the commissary. So they let a certain number of people in, and then 30 minutes later they let another certain number of people in, and we were monitoring people coming out and in to ensure that we again are not crowding the commissary, and there is available space to enforce social distancing. They also have placed markers on the ground in areas, especially high volume aisles, in which people can wait the 6 foot distances. It helps spread people out. Also at the checkout counters, both at the commissary and APs, they put plexiglass up to protect both you and the cashiers. And then also the commissary has expanded their quick to go. I said that last week. They've added additional orders that can be picked up at the commissary. Before I leave the commissary, I'm going to answer a couple of the questions that are open questions, and then some of the questions from last time that were not answered. So the questions that came up for the commissary this time, the first one I want to address, again, this is where inaccurate information comes in. Someone posted on Facebook about a positive test from a commissary worker. Again, I ask you only to provide accurate information. I confirmed again today with the commissary manager, there is not a commissary worker that has tested positive for COVID. So again, I ask you to only provide accurate information. A question is, can we have the commissary switch to a one-way traffic in aisles like they're doing in other stores? It helps with social distancing. I will tell you the commissary has considered that. We've talked about it. And at this time, the commissary can continue to do the practices that they're doing. It is a very large commissary with a lot of folks. There's a lot of logistical work, and at this point, it is better just to mark the distances. Again, people should use common sense. On aisles that are full at one point, we are limiting some access to the commissary, the numbers, to allow for not as many people in the commissary. We've already addressed the commissary requiring face covering, and again, the answer is yes. Tomorrow, it'll be an item that is dictated by the commissary management. Why can't the workers who man the click and go lines accept tips? They work so hard, and we appreciate everything they're doing for us. I don't disagree with you. I know everyone is working hard at the commissary. The reason why they cannot be tipped is they are government employees, and under regulatory guidelines, government employees cannot be tipped. people will probably ask on Facebook Live, and I can't see the questions. We do it for the baggers. Why can't we do it for them? I'm going to just remind you that baggers are independent contractors, and they do work for tips. And so again, that is the difference between the baggers and the quick-to-go employees. Will the commissary manager consider having designated hours of categories for residents, active duty, retirees, with residents having first priority? I saw a lot of the comments on Facebook, a lot of the arguments back and forth. The bottom line is we have looked at that, we've considered it, but no, at this time, we are not going to have designated hours. What I ask that you spread your shoppings out. If you're coming in the morning, and again, this is difficult, because if everyone in the morning comes in the afternoon will become crowded. But again, if some folks can begin shopping in the mid-afternoon and evening, you'll see that the shopping is a lot less crowded during those times. If you have if you have to take your toddler to the commissary or exchange with you, can you? Some of us have no one to help at times. And the answer is it's not recommended you go with other family members if you can. However, that being said, we understand circumstances. So you can absolutely bring your toddler or your child with you if that's the only way you can get to the commissary. So again, you will not be denied access by any means, and understand the circumstances. Will the commissary ever have senior shopping hours? The answer was no. I've read the comments. I've read some comments that some bases have restricted the retirees and their families from using the commissary, and some from getting on base completely, which is unfair given that they have earned this. The commissary put out a video how committed they are to serve active duty and their families, as well as retirees and their families. But some Garrison commanders went against this. Can you please give some assurance you will not be doing that? I could assure you at this point we are not doing that. Again, I cannot promise, but because again, I do not know what Department of Defense will tell me. However, there is absolutely no indications, nor have I gotten any guidance that we will ever stop providing those benefits to any beneficiaries at the commissary. In reverse, I've been given very clear guidance that we will continue to do everything we can to keep the commissary and APs open to all beneficiaries. So again, I am not going to tell you it can never happen. I will tell you all the guidance I've received to date has been to ensure that our commissaries and APs are supported with whatever is needed to keep them open, and to definitely allow those open to all beneficiaries. And like I've said in all town halls previous to this, even if the base does elevate to HP Delta, which I'm telling you right now, there are no indications today that is happening. But if that does happen, I've told you in the past, as I'm telling you today, that Fort Belvoir will remain open, and access to the commissary and PX will be made available for all beneficiaries. I think there was an unanswered question on the commissary. Can the commissary employees either change gloves with every customer or not wear gloves and sanitize their hands? I'm going to answer this one, but I'm also going to tell you what we're doing across the installation at large. And so I thank the hospital and really your public health assessment nurses and your subject matter experts. But what people are not seeing is every week the hospital has provided support to the Garrison, the installation. And they are going around to all our facilities, to include the commissary and APs, to check on the way we're doing our business practices and ensuring that we are doing it within guidelines of CDC. They go to the shopette, they're going to the food developments, they're going to all the other areas that are high volume, to our child development centers, to ensure that we are doing the proper measures and we're implementing effectively. And so that is being done. Specifically on this question for employees, so they are doing what is within the CDC guidelines. They are changing gloves out periodically. They are also hand sanitizing those gloves as they're working. And then, as I said, there is a plexiglass up to protect both the cashier and our patrons at the commissary. Why aren't there cleaning wipes available to wipe carts when you have to shop at the commissary? I will tell you that those wipes are available to wipe down carts. If they are not available, please see a store manager and let them know the wipes are out. They do monitor those. Every time I've been to the commissary to visit, not just to do my shopping, but also just to visit to make sure things are operating correctly. There have been wipes out either at the door or where the carts are placed, and people are using them. So again, if you don't see it, ask where it is at. If it's empty, please let the commissary management know, and they will put more wipes out there. And then we've already answered the one-way aisles. So that's all on the commissary. On the exchange, a couple of new things. And so tomorrow again is our first day, but the AFES is launching a curbside pickup amid to the COVID-19 pandemic. Again, it's on the exchange sites as well, but this will help family members. It's almost like the click to go for AFES. Again, you can shop. You can shop on the AFES website. And I don't apologize, I don't have it in front of me. shopmyexchange.com. You can also find instructions out there as well. We're still working on the signage, but there'll be 4 dedicated spots in front of the AFES for those pickups. And again, we will start that. AFES will start that process tomorrow. Again, I ask for your patience as they stand this up, and we start to implement that at AFES. Please keep yourself informed on our social media platforms on AFE hours, both the main exchange and our concessionaires that are here on the installation. We continue to update that as hours are changed, but please note on Easter the commissary will be closed. I think there were 2 questions. So the first one on AFES, when will AFES provide the appropriate PPE, masks, and gloves for employees based on Dr. Esper's guidance released on 5 April? So the answer to that is the gloves were always provided, have been received and provided to the AFES employees. The masks have come in today, were issued today, and employees should be using those tomorrow. So appreciate your concern on our employees. And like I said, tomorrow all AFES employees should have face coverings and have gloves. Will Arby's and Burger King transition will they transition to drive-through only to help reduce the exposures to others? Again, to point out, public health assessments have been done on Arby's and Burger King, along with others on the installation. We're following all CDC guidelines. Again, I talked to the assessor today as well about this question. And again, he assures me that we are following all procedures properly. And we are not looking at closing the grab and goes at those locations because it provides 2 access points to get that food for one, and there's minimum exposure when you're doing grab and goes for COVID to transmit, and we are also, AFES is also doing all proper procedures for cleaning at the periodic timelines specified by CDC. Okay, I think that answers AFES. So again, forgive me as everything is scattered. So for SJA, I'm going to update on SJA. So again, I want to remind you, I said it last time as well. Anyone seeking legal guidance may call the Legal Assistance Office at 703-805-2856 to set up an appointment. All appointments are conducted telephonically, and we do have procedures in place to accommodate most legal matters. If you're calling after hours, potential clients can leave a voice message, and your call will be returned the following business day. Again, that number is 703-805-2856. Okay, for a Garrison Command leadership team update, I guess these were some questions that weren't answered last time. So where can I check FPCON levels? So right now, FPCON levels, or force protection condition, is B+. Those are posted at the entrances to the installation, and so as you're entering the installation, you can see that that FPCON level, and that has not changed. With these items you just revealed, why isn't the base going to Delta status? I will tell you that we assess the conditions each and every day, not just the Fort Belvoir team, but the National Capital Region, the Joint Task Force that Major General Jones is the commander of, across the region. Those conditions are assessed each day. General Jones does have dialogue with each of the garrison commanders, both Fort Meade and myself, Fort Myer and AP Hill. And as conditions migrate, if they elevate and it sets precedence to elevate to an HPCON Delta level, General Jones, the MDW and Joint Task Force Commander will make that decision, and then we will execute and notify the population, the community, as those are done. Captain Judy, I'm gonna turn this over to you. The question is, what agency is in charge of tracing if it's Fort Belvoir residents who test positive?
Yeah, so that's an interesting question. For our Fort Belvoir residents, they live in Fairfax County. So if the testing is done at Fort Belvoir Community Hospital, then Fort Belvoir Community Hospital, in conjunction with Fairfax County, does that contact tracing. When a patient goes out in town and seeks care, then it's typically that healthcare organization that did that testing that's working with the county health department. So it's possible that somebody could be contacted from an external agency, not Fort Belvoir Community Hospital, when that contact tracing is going on.
Okay, thank you. Okay, so the next one is, how is post enforcing the stay-at-home orders? I think this is probably a couple other questions about, how we just enforcing standards. Okay, and I would tell you, I thank the community, okay, because we haven't had to do a lot of enforcement out there. We haven't had mass gatherings. Okay, there's been individual, potentially some people who are migrating, 5 or 6 people on a field. And again, I ask the community, if you see something, say something. If you are one of those that are in a large group, I ask you to social distance or to wear a mask, okay? And a correction, a face covering, not a mask, a face covering. And again, I want to also let you know that just because you're wearing a face covering doesn't protect you from this virus. It helps you, but I want to make sure that people are not so confident that they are now 1 foot apart from each other talking and thinking that they were 100% protected. This helps out with preventing the virus from spreading. But again, I ask you to still keep some distance from others if they're not in your household or family members. Again, the face coverings will help, but I don't want people to feel so confident that we start having mass gatherings with the mask, with the face coverings. You have any comments on that as well?
No, there's a lot of controversy over the face coverings, in all honesty, as to what we're really protecting from that. And so I think the biggest benefit, in all honesty, is that it prevents somebody, when they cough or sneeze, from projecting anything out, right? And so a lot of people think that face covering is doing a lot to filter something coming in from the air, but it is not a filtration device. It's really keeping people from spreading things when they cough or sneeze.
Okay, great. Thank you. So the next one, it says, will CIF be open? Will CIF be opening for transition soldiers, or will units count for gear? So from the LRC, CIF has been and will be operational for all ETS and retirements. We are not conducting in-processing an issue except for critical mission support, primarily medical personnel. Hours of operation are Monday through Thursday, 0700 to 1430, and Friday they're closed. Okay, again, the hours Monday through Friday, 0700 to 1430, and Friday they're closed. Okay, I'm going to turn it over to Mr. Dixon. Sir, if you can answer a couple of these questions. You have 3 questions in front of you?
I do.
Okay, please answer those. Thank
Okay,
you.
question 1, is the campground under the same rule as the rest in the state of Virginia? The short answer is no. You are allowed to stay up to 60 days during peak season and 90 days during the off season at the travel camp. If you have additional questions, we ask that you call 703-805-3081. Question number 2, will access outdoor facilities such as water launch ramp, fishing, and other outdoor areas be available for families to stay active? Yes, both at the marina and Tompkins Basin and the rest of the installation. If you see signage saying that you're not allowed into this area, we ask that you abide by the rules of that signage and be safe. Next question, number 3, can the golf course trails be used for exercise, walking and running? The short answer is no. The Fort Belvoir Golf Course is currently closed. However, there is still ongoing maintenance of the Gunston Course and Woodlawn Course by the grounds team. The ground teams are using tractors and other heavy equipment to maintain the course. For the safety of our guests and ground team, the cart path will remain closed. And there's additional road golfers out there, so we don't want you getting hit by a golf course. So unfortunately, the answer is no. Thank you.
Okay. So I'm going to continue on. I know we are running a little short on time, so I'm going to continue to drive forward. So a question about, again, kids hanging out or playing. How are we enforcing the shelter in place? Again, I ask parents to also help us. But again, if we need to get involved, please call the Department of Emergency Services, our dispatchers, and we will send a police car to assist with that efforts. Our police, as they're driving around, are also paying attention. But again, they are also providing other securities around the installation.
Sir, I have a few.
Yes, please.
Okay, so there was one on here, is there COVID-19 testing for individuals that don't have a fever? So COVID testing is done based on medical history, symptoms, and exposure. So there are cases where somebody might present to that outdoor COVID testing area and not have had a fever, but still meet the criteria for testing. So that's a discussion that happens between the healthcare team and the individual that's seeking that testing at that time. Another one I had was, what is the purpose of Fort Belvoir Community Hospital reducing the meal options to hamburgers and hot dogs? So when we restricted access to the hospital, it resulted in a significant shift in the demand for meals. And then over the past weeks, the cafeteria responded to a bunch of feedback from the staff and the patients that what they really wanted, they missed the deli line, was one of the biggest dissatisfiers for them. And they wanted more salad and sandwich options. And so as a result, they prepared a much wider variety of sandwiches, salads, and wraps, and so on, in addition to hamburgers and hot dogs, and then they were offering pizza too. Based on continued feedback, they've adjusted and they've added some of the warm entrees back to that, and we'll continue to tailor that based on what we hear.
All right, great.
Okay.
You have more as well?
No,
Some
I'm
more
good.
questions? That's it?
I think that's it.
Okay. I'm going to let DPW, can you go ahead and just talk about your questions real quickly?
Yes, sir. Thank you, ma'am. Good afternoon, everyone. I'm Mr. Mariani. I'm the acting deputy director of Public Works. The first question that we received was, I work for DPW's maintenance contractor, and we are fully staffed, and until today was given information of what buildings had positive testing done. With that said, our technicians are in and out of all buildings every day and can transmit the COVID-19. We need to consider us, the contractors, not being base essential personnel. What are your thoughts about this? Well, the answer is that the DPW maintenance contractor is considered a mission essential part of the DPW team and is required to continue to support military operations on the installation. The DPW maintenance contractor is required to by the contract to ensure the safety of all the company employees. The contractor is required to comply with the city and the corporation's COVID-19 guidelines. The DPW maintenance contractor is tracking the buildings that have been tested positive and under the contract are required to conduct emergency response and deep cleaning of all those affected facilities. Second question.
I'm gonna cut you on that one because we're running out of time. I'm gonna let Mr. Rennick just talk
Yes, sir.
a minute about DHR. And then what I'm gonna tell, point back at me for a minute. And so what we're trying to do is we're trying to answer as many questions as possible. I know there are other questions out there. We do have our frequently asked questions. We are also, Captain Judy and I, looking at those as they come in, and we'll continue to provide feedback as we go out and then provide updates next week. So Mr. Rennick, if you could just provide just a couple of your hot questions, and then the two other DPW questions, we will get written responses out to the community.
Good afternoon, everyone. Kevin Rennick, Director of Human Resources here for the Garrison. I do have a few questions. Question one, went to the CAC office for an appointment and it seemed it was closed. Just to answer that question, our ID card facility is not closed. We are open. We are open Monday through Friday, 8 to 1600. That's 4 p.m. every day. If you check the website, it will tell you that we are honoring appointments due to COVID-19, and that's for the prevention and protection of both you and the employees that will service you. The next question, which is a big question, when will MPD start releasing orders to those who already have an RFO or on assignment after May 11th? Great question. The Military Personnel Division are working extremely hard during this challenging period and doing its best to meet the needs of the population. They are in high peak season due to the volume of enormous enlisted and officer assignments. They are prioritizing publication of all orders based on report dates and completion of soldier PCS requirements. We will continue to conduct levy briefings, levy packets, and we are issuing orders. We thank you for your patience and your understanding. We are working in concert with both your Unit S1s as well as your organization leadership in keeping them abreast of all HR associated programs and services during this period. Last question, another big one, ID card extensions. As of yesterday, new policy for ID card issuance was published. The policy states if cardholders' affiliation is unchanged, possessing a uniform service ID card, which expires on or after 1 January 2020, they are authorized for continued benefits through 30 September of 2020. If you have any other questions as it pertains to the questions that I just answered, we ask that you please go to the DHR homepage and also check our ID card facility website for additional information. Thank you.
Thank you. Okay, we're gonna close up. Captain Judy, any closing remarks?
No, again, just to thank the community, there's a lot out there. We talk about the spacing in the commissary, I know that's gotten a lot of discussion. We have the same situation in elevators in the hospital, and it's amazing what putting a few footprints on the floor of an elevator will do, that people look at that and then follow through with making sure they're protecting themselves and one another on that elevator. So a lot of real great partnership with the community, and we're seeing some optimistic numbers in all of the epidemiologic models. And so we remain guardedly optimistic at this time and appreciate everyone really doing their part. Thanks.
Okay, and then just closing up today, and again, we will continue to do this weekly, or if conditions change. Again, the next one will be next Thursday at the same time. First, Captain Judy and the hospital, thank you for what you're doing for the community. Okay, and people don't see it, but we got our first responders coming in every single day, putting their lives at risk. And it's not just the hospital, it's Department of Emergency Services, it's all the contractors that support this installation. But to your team, thank you for providing all the guidance and support to the community. To everyone else out there that are working, that are supporting this installation, thank you for what you're doing each and every day, whether you're at the gates or you're providing first response firefighters, or you're maintaining our buildings, or you're maintaining our homes. For all those out there supporting, thank you so much for what you're doing every day. My number one priority still remains during this health emergency to protect our community. I ask you for your understanding and your patience as we go through this. Again, we will continue to update on our best ways of beating the virus. I ask you to continue to exercise all precautionary measures, to include social distancing, the wearing of our face coverings, and everything else prescribed by the CDC. Thank you today for participating in the town hall. A closed caption video will be posted on Facebook. Continue to follow our Facebook page and our website as a good resource for the latest information. Please stay safe. Thank you for listening, and we look forward to the next update next week. Remember, we are all in this together. The longer we stay at home and apart, the sooner we will be together. Again, thank you, and stay safe.